Good afternoon, everyone. Lisa Gustafson with Cool FM Live. And today we want to thank SSVEC for bringing us this very exciting community announcement for November being National Hospice and Palliative Care Month. Right, ladies?
Yes, yes.
I'm going to introduce you to Miss Shelby here on my left, who is the Executive Director for Casa de La Paz. And then we have Miss Alex, and she is the Patient Care Representative here at Casa de La Paz. And we want to talk about, obviously, hospice and the care that you offer, and go into some detail on some other items. So we want to first thank SSVC, Sulphur Springs Valley Electric Cooperative, serving our community, for bringing this very informative discussion to everyone. So Miss Shelby, let's first talk about what hospice is.
Hospice is, and people hear the word hospice and they panic. They panic. They don't want to hear it. They say, I'm not ready. So people think that hospice is for the very, very end of life, when in fact it's really for those people who have an advanced illness that's really no longer treatable, and people who no longer want to go to the hospital, have their signs and symptoms treated at home instead of at the hospital, when there's usually not a whole lot to do except for some kind of maintenance care. So hospice is a group of a whole team. We have an interdisciplinary team. We have RNs, we have doctors, we have nurse practitioners, we have social workers, we have bereavement counselors, and we have nurses' aides. And we all build a care plan that's specific to you or your loved one, so that you can receive care at home. You can be comfortable. You can stay home where you want to be. You have someone who's on call 24 hours a day that can come anytime. And so a lot of times people just don't understand that it's not just for that last week or two of life. It's really very beneficial if it's 6 months to a year.
And so I'm going to jump in here and say, we had talked at length the last time when we got together, and I don't know if I'm the only person that thought that, but a lot of times that's what people think. And you ladies had pointed out, people contact you too late. They don't understand that hospice isn't just about that last week.
Right.
You'll do so much more than that. So I think it's so important for people, don't be scared to make that call, and you'll learn it is much more than that.
Well, and making the call doesn't automatically bring you on.
Right.
So just get that information and educate, because even physicians are, they struggle to give that information for end of life.
Absolutely. Absolutely. And I can see why. It's a difficult time for everybody. What kind of services does hospice provide? What are the actual services? I know you had talked about, you have the RNs, you have, medical, you have non-medical. Can you go into detail a little bit more about those?
So on top of the disciplines, or I guess the nurse, the nurse's aide, the chaplain, the social worker, the bereavement counselor, we also provide services. We can bring you durable medical equipment like a hospital bed or a wheelchair or a bedside commode. We provide and deliver to you some medical supplies or briefs, bed pads, anything for wound care, those kinds of things. Those are all part of your hospice benefit. And then we also provide medications that are related to any kind of comfort, and also medications related to the diagnosis that you're on with us for.
Okay.
So all of that, all of those benefits, and the 24 hours availability for a nurse, and all of that is paid for 100% by Medicare.
I was just going to ask,
and by Medicaid.
Who pays for it?
Yes, it's 100. There is no expense out of pocket for Medicaid or Medicare.
Okay.
And then we take most commercial insurances, and most people's policies. There's nothing out of pocket.
So that has to be a huge help to families.
And everything's brought to your home. I mean, so if your loved one, or if even if the spouse that's caring for the loved one can't drive.
Sure.
We have all kinds of resources. We work with VICAP, we work with Synergy, we work with all these community to help support them so they can stay home.
Yeah, and you have great partnerships. With
Wonderful partnerships.
You really do. So that has never been a question. When is, we touched on this a little bit, the right time to call hospice?
Well, the right time is when you have had increasingly frequent visits to the hospital. If you're being hospitalized every couple of months, or if you've been hospitalized in the last 6 months 2 or 3 times for the same conditions like congestive heart failure or COPD, which is respiratory failure, those kinds of things. If you have just a general decline, if you were walking around 6 months ago and now you're in a wheelchair or you're need to have transfer, that's an indication that you're declining. Anytime you need extra oxygen or you're more short of breath, anytime that you're calling your doctor every week because you feel like you're just not doing well,
right.
All those are indicators that you're declining, and that's when it's time for us to step in.
So a family member, I'm assuming, could give you a call and reach out to you. And what is walk me through the process. Once somebody makes that call, then what happens? Do you have those difficult conversations? Obviously, there's a whole list of things that you probably run through. So for somebody out there that has maybe been scared to make the call, what would walk me through that process for them?
Well, the first thing we do, especially if someone were to call, ask them on the phone, make them a little bit more comfortable. What's going on? What do you think that you might need? And obviously then we offer to come to the home and do an assessment. Let us talk to both of you or all of you, or if you need a family meeting.
Sure.
So we run through all the things that we talk about. A lot of times there's families, especially here, that are out of town.
Right.
We have a lot of people whose families live somewhere else. So we try to include them at least on a phone call or a conference call so that everybody understands what's going on. We usually ask who their doctor is, and we let the doctor know that we're having that conversation, their primary care doctor. So that's usually the first thing we do. We work with a lot of the assisted livings, and they see also decline. So with that decline, they may call and they may have suggested to the family to talk.
And so I'm guessing that's kind of like the doctor, though. It depends on the doctor and the care facility that they're at, who makes that judgment call or says to them, maybe you should look into hospice.
Right. And I think most of the care facilities here in Sierra Vista make that call and have talked to the families, and then that's when we come in, and that's when we then kind of talk to the doctors. Yeah.
So again, great group that you've everybody that partners together within our community. Where are you located?
We are, our office, our official office, is located on 49 Coronado Drive, which is right behind Sierra Health Mart and right across the street from Arby's. So you can't
kind of tucked back in the corner.
Back in the corner. It's hard to see, but if you love Taco Euro, you'll drive right by us to get to their back parking lot, or you'll park in our parking lot.
For sure.
So our care is given in your home. So we come to whatever it is you call home. It might be your private home. It might be, Via Elegante. It might be Prestige or Mountain View Gardens. There's several assisted living. So wherever you call home is where we go.
So that's a great question, because people may think that those facilities provide it, but you actually can go in and provide the care.
Right.
Yes.
We provide that extra support and that
Very nice.
that end of life care, so that we can educate their caregivers. We work very closely with Haven and Life Care and do all kinds of teaching and education. But yes, that we can go in and supplement the care that they have there.
Well, and I like that you said wherever you call home. I think that's most important. Now, we have included your address and phone number in the post description, but what is the best way for people to get in touch with you?
So the best way is probably if you see Alex out and about.
Which Alex is everywhere.
She's
Everywhere.
Or our phone number.
Okay.
Gina or myself, we're here. We have Annette, our bereavement counselor and social worker. We're all willing to sit and talk with you on the phone. So
Perfect.
I think our phone number is on.
Yep.
And so that's the best way.
And 24-hour service is available, correct?
Yes.
That's huge. Well, ladies, I am always amazed every time I come down here and I sit and chat with them, because I don't think people know enough, because hospice does have this scary word to it.
Yes.
But it's so much more than that. And you offer so many services that people do not need to be afraid of and would be comfortable for a much longer time. Is it safe to, is that a
That's
good
a
assumption?
very good assumption. It's a very, it shouldn't be scary. And one of the things that I always tell families is hospice begins with an H and hope begins with an H.
There you go.
So people say, oh, well, we're not ready to give up hope, or we're not ready. So the thing that I always tell people is, what are you not ready for? Are you not ready to be comfortable? Are you not ready to stay home? Are you not ready to have our team come in and support you? And you can always come off of hospice. It's not like once you're in, you can never get out. If you decide that this is not the care for you and you want to go on and try something else, you can discharge, and that's fine. But to say you're not ready and to say there's no hope is really taking away from those who could benefit from the service.
Sure. Because, I mean, we touched on such a small number of the services today. So I thank you for always being clear and going over this information, especially with me, because I learned so much. Any other, encouraging words, Alex or Shelby, that you want to give to somebody, or talk about, the hospice care and everything?
No, the only thing I would have to say, I think Shelby covered everything.
You did,
she did
yes.
very good.
Great job.
But one thing, going out and about, I think we all do consults when the families do come in, or we get those referrals. We do all go out and do consults. And once we get the patient admitted, I think the biggest thing we hear is, I wish we had hospice sooner.
Yes.
Because of the amount of benefits we're able to provide, and the services and all of the partnerships that we have that come in and support. And so I think that's our biggest piece, is that they always say that they wish that they came on sooner and that they had our services a little bit sooner. So that's why we're here educating and spreading that word. So if there's any questions or concerns, please do not hesitate to reach out to any of us, and we'll be happy to answer any of your questions.
Yeah, absolutely. Everybody here at Casa de la Paz has been wonderful and helped so many people, and we certainly appreciate that. So do not hesitate to call, even if it's a simple question. I think it's important to make that call and get the correct information from the experts here.
Well, and if it's something that we can't help with, we have lots of partnerships that we can then refer you to other places.
Absolutely.
So
You won't leave without an answer.
There you go.
We either have the answer for you, or we get you connected. Yes.
Perfect. Well, we love that. Ladies, thank you so much for taking the time to talk to us about all things hospice and the palliative care today. And I do want to say a huge thank you once again to SSVEC, Sulphur Springs Valley Electric Cooperative, serving our community, for bringing us this very important information. We thank you. And ladies, great job.
Yes, thank you.